A very good morning to everybody. My name is Ahmed Ogwell, and I'm CEO at VillageReach, and a very proud Chic member.
And hello, I'm Ash Rogers. I'm co-CEO of Lwala Community Alliance, a proud Chic member, and also a member of the Chic Advisory Board. And we're so excited to have you all here with us today. For those of you who are new to the Community Health Impact Coalition, Chic, our mission is to make pro-CHWs the norm worldwide. That is through changing guidelines, policy, and funding. Community health workers, just like Margaret, who we've heard from, they're trusted by their neighbors to extend care to every home. Research shows that they improve health access and health outcomes, and that for every dollar invested in a community health worker, we get a 10-fold return. And yet, community health workers are woefully undersupported. We rely on them in pandemics and crises, and yet many go unpaid. That is why we are committed to professionalizing community health workers. A pro-CHW is one who is paid, trained, supervised, and equipped to deliver health for all.
And we all know that successful interventions are only sustainable when we see clear policy change. Chic's global progress in advancing pro-CHW policies is reflected in this new dynamic dashboard, which is up here. It highlights where momentum is building and where strategic mobilization is actually needed. Currently, we are tracking the salaried and accredited status of CHWs in each of these countries. The goal, every country on this map turns purple, signaling that CHWs everywhere are set up to deliver quality healthcare at the last mile.
So far, 50 countries have passed pro-CHW policies that accredit, pay, and supply community health workers. And many of those countries are in this room today. 9, thank you, yes. And 9 have been added to this list just in the last year.
A critical enabling factor to achieving policy wins is the rigorous evidence that decision makers depend on. How does that show up? We have published 16 peer-reviewed papers with almost 180,000 views. 2/3 of these papers include CHWs as co-authors, helping raise CHW voices and visibility in the global health space. When people who are delivering care shape the evidence, research is stronger, it's more relevant, and it is more likely to drive change.
The real magic of Chic is that all of us coming together are able to speak louder than any one of us could alone. And that is why some of the biggest funders and norm setters in the world rely on Chic and trust us and give us the opportunity to help influence their policies, their strategies, their guidelines. That includes Global Fund, UNICEF, Gavi, the Asian Infrastructure Investment Bank. And Chic also contributed to the WHO's first guidelines for community health workers. And all of this is meaningful. WHO has 194 member states who look to their guidelines as they're forming their own policies. So when community health workers are written into these policies and guidelines and strategies, that translates into real resources on the ground.
And actually, global recognition of our impact is growing. Since 2024 October, Chic has received various recognitions. IHME's Rowe Prize, Schwab Foundation's Collective Innovation Award, and the Skoll Award for Social Innovation, meaning our vision to professionalize CHWs is resonating on the world stage, and it is reaching much wider audiences.
Chic is translating this momentum the increased evidence, the new global guidelines into policy change at the national level via SHIC members. For example, in Kenya, SHIC members came together under the leadership of the Ministry of Health to form the CHU for UHC, which is a powerful national coalition that includes Lwala and VillageReach and Living Goods and Medic and 28 other civil society organizations in Kenya. It includes Margaret's organization, which is the national organization organizing community health workers. And together, we were able to work with government and support some landmark health reforms. The Kenyan government has committed to and actually put in national resources to pay community health workers, to equip them, and to support them with an electronic community health information system. And what's exciting is that Kenya's not the only one. SHIC is collaborating with 7 national NGO coalitions and 8 CHW-led coalitions around the world.
And at this juncture, I would like to congratulate the Honorable Minister of Health of Mozambique, because Mozambique is developing new approaches into the health sector, and the community is at the center of that. So congratulations, Honorable Minister. SHIC's recommendations are included in the updated WHO benchmark for strengthening health emergency capacities, a major step in embedding community health worker priorities into global standards. It ensures that community health workers are recognized as essential to preparedness. Ultimately, though, embedding community health workers into emergency preparedness frameworks isn't just a smart policy. It's a strategic imperative for resilient health systems that serve everyone, everywhere, especially the most underreached communities.